Hello and welcome to Delta Cast Tutorials. My name is Lindsey, and today I'll be demonstrating a Thumb Spica Munster cast using the functional cast therapy technique. So this particular cast, we're going to be immobilizing the thumb and forearm. It may be for a scaphoid fracture, both bone forearm, any injury where we really want to stop them from doing any supination or pronation, but allow for some elbow extension. They can just slide out their extremity instead of supinating or pronating it. This will allow for excellent immobilization while they continue on with therapy process and decrease elbow stiffness. We will start by adding the Delta TerryNet stockinette on this patient. Carefully rolling down the stockinette past the elbow. We'll start by adding padding to all the bony prominences using Delta TerryNet adhesive foam padding to the elbow, ulnar, and radiostyloid. The thumb area, of course, of first metacarpal, maybe areas on the lateral portion of the thumb on the styloid, any area where you need protection. Let's cut a hole for the zip stick so it can be placed on the radial aspect. I'm using 2 zip sticks and will remove one later on so it can allow for more space for my scissors. I'll place them on the radial aspect and pull them proximal up and underneath the stockinette. Add your foam padding. I went ahead and added an extra piece around the elbow, like a donut, because this patient's elbow was still very prominent. Here I'm adding the padding on the first metacarpal joint, and then I'll place more padding on the lateral sides of the IP joint so that it's more comfortable and secure. I like to use the analogy where it fits them like a football helmet, very snug but secure. The goal is we really want the patient to be compliant with donning and doffing the cast. All right, let's don our gloves, and we're going to be using Delta Cast conformable tape. It's a polyester cast tape with a 3-way stretch. It's a fabulous way to conform the cast on the patient's extremity really well. I'm going to be using 2 rolls. I'm going to put 2 struts where I have 2 to 3 layer fan folds, and then incorporate in to make the cast strong only in those areas. So first, make your fan fold. One of the struts will incorporate the thumb, and that'll be on the radial aspect, but going toward the volar aspect of the forearm. The second strut would be on the dorsal aspect. I prefer to start at the thumb and do half cuts, so I can go around the thumb without making wrinkles. And do that at least twice because it's nice. Gotta have fun while we're working. And then start in cooperating the wrist and hand. As I move more proximal, I'll start using the 50-50 coverage method, where I have 2 layers everywhere I'll go. Now this is important as we move down proximal and we start to incorporate the elbow. You don't want to put so much cast tape in the antecubital space of the elbow fold. So I do small half cuts so that it's not that much cast tape material in that area. It may not look aesthetically pleasing, but it will be easier to cut for trimming. Here's an alternate way to strengthen up the elbow area without putting so much cast tape in the antecubital fossa area. You can fan fold back and forth only on the elbow, maybe 2 to 3 times, and then incorporate that in the diameter as you apply and move more proximal. Once you finish, start to laminate the layers that you put on by rubbing the cast vigorously to ensure the layers are very strong and mashed together. If the cast is sticky and tacky, wet your gloves. This will allow the cast to be more slippery to laminate. For more secure supination and pronation prevention, you can do a traditional mold above the epicondyles. This is why it's important to pad up the elbow well if you're going to be doing any aggressive molding. To allow for greater restriction of supination and pronation of the forearm, place the molds above the epicondyles. Now the fun part, we're going to start doing our markings to know what areas we need to cut. That's unneeded material, so we're going to open up the elbow. We are going to cut above where we placed our molds. Do not cut them out by mistake. Remember, the mold prevents rotation. And again, we're going to open up the back of the elbow so that the patient can slide their hand out. We're going to take the metacarpal heads out at the top of the cast, and then we're going to make an oblique, angled look around the distal palmar crease. This palmar area is where the lower end is on the pinky side. Remove one of the zip sticks out to allow for more room for your scissors. Use small cuts to move proximal up the arm toward the elbow. Use your other hand to bow the cast open even more as you move along. Remove the cast and start to trim the areas that you marked. So here I'm fitting the cast on the patient to check the range of motion. I opened and cut the cast around the thumb area. I made sure not to remove my molds and it's comfortable around the patient's elbow. The lower you cut and modify the posterior aspect, the more extension of the elbow the patient will have. Go ahead and lower the posterior aspect of the casts, depending on how much extension you want the patient to have. And then cut open the posterior aspect down the middle to ensure that you can open to slide the patient's arm in for fitting purposes. Trim any sharp edges. fit the patient, and then trim more if applicable. Apply Delta Terry adhesive hook to the exterior portion of the cast. Now for the aesthetic portion, we're going to add the Delta Terry net fleece edger on that outside. I like to go on the straightaways first because it's a little bit easier to get started. Place half the width on the outside and half the width on the inside, and then lay it down. Continue edging the cast and go around the curved areas until completed. Fit the patient for comfort and modify if needed. Apply Delta Net Terry loops on the hook portions to secure the cast. Trim any excess loop off. Apply adhesive fleece to the loop tabs for visualization of how the straps should be removed. Check for the satisfactory range of motion needed. This is the Munster Thumb Spica cast using the functional cast therapy technique. Thank you.